Alexander James adjusted the stethoscope around his neck as he walked through the sterilized hallways of Stone Creek Municipal Hospital. It was a typical Tuesday, or at least it had seemed that way so far. 12 hours into his ER shift, and he had already treated 3 deep lacerations, a mild concussion, and 2 asthma attacks. Nothing out of the ordinary for a veteran with 15 years of emergency medicine under his belt. "Dr. James, we need you in room 3, now." The urgent voice of Nancy, the ER's head nurse, snapped him out of his thoughts. There was something in her tone, a mix of urgency and disbelief, that made his body react instantly, quickening his pace before his brain could fully process the words. "What do we have?" he asked, already pulling on a fresh pair of gloves as he approached. Nancy, a woman who had seen it all in her 25 years of nursing, looked genuinely shaken. "Honestly, doctor, you have to see it for yourself. I've never seen anything like it." Intrigued and increasingly uneasy, Dr. James pushed through the doors of Trauma Room 3. The smell hit him first, a sharp blend of rust, sweat, and something undefinable that turned his stomach. Then came the sight of the patient, and for a brief moment, time seemed to freeze. In the center of the room, surrounded by a team of nurses whose faces flickered between shock and professional focus, lay a man in his 40s. His body was covered in dark mud and leaves, but that wasn't what made the scene so surreal. It was the object piercing through his abdomen, a tree branch, nearly 2 inches thick, entering through his left side and exiting out his back. "Good Lord," Dr. James muttered, quickly snapping out of his initial shock. "Vitals? Blood pressure is 90/60 and dropping, pulse at 120, shallow respirations at 24 per minute, oxygen saturation 92%, one of the nurses reported, maintaining her professional composure despite the extraordinary scene. The patient was conscious, his blue eyes wide with a mix of pain and confusion, yet strangely calm, considering the circumstances. "I'm Dr. James," he said, stepping up to the gurney and instinctively taking control of the situation. "What's your name?" "Michael Everett," the man replied, his voice surprisingly steady. "Michael, you're at Stone Creek Municipal Hospital. We're going to take care of you, but first, I need to understand exactly what happened." "I was hiking in Cedar Ridge Forest Reserve," he began, speaking in broken phrases between shallow breaths. "Slipped down a slope, fell about 20 meters, landed on a fallen tree." Dr. James nodded, processing the information as he carefully examined the area around the wound, taking care not to touch the branch. "How did you get here?" A faint smile crossed Michael's pale face. "Walked 2 kilometers to the parking lot. Drove myself here." The doctor froze, exchanging a stunned look with Nancy. "You got yourself here, with that going through your body?" "My phone had no signal," Michael said, as if explaining the most reasonable decision in the world. "And I'm a doctor, too. Knew I shouldn't remove the object." "You're a doctor?" Dr. James felt another wave of shock. "What's your specialty?" "Pediatric neurologist at Westlake Children's Hospital." It was an almost absurd coincidence. James knew Westlake well. He'd referred patients there many times. He could easily have crossed paths with this man at a medical conference. "All right, Dr. Everett," Dr. James said, quickly composing himself. "We're prepping for surgery immediately. I need you to stay conscious as long as possible to give us as much information as you can." Turning to the team, his medical instincts fully engaged, he barked out clear, precise orders. "I want 2 units of O-negative here now. Start broad-spectrum antibiotics, morphine for pain, and page general and vascular surgery immediately. We need a CT scan to map the exact path of that branch before any attempt at removal. As the team moved efficiently around him, Dr. James turned his attention back to the patient. Michael, I'm going to be straight with you. Doctor to doctor, your situation is extremely serious. That object may be compressing vital organs and blood vessels. It could very well be the only thing keeping you from bleeding out internally. Michael gave a small nod, his eyes reflecting a clinical awareness of the gravity of his condition. I know. I thought about that on the drive here. If I don't make it, my ex-husband, Daniel Everett Collins, he's my emergency contact. We'll do everything we can to make sure you speak to him yourself, Dr. James replied, with firm resolve. But I'll make sure he's informed. At that moment, Dr. Patel, the chief trauma surgeon, entered the room. He paused briefly, taking in the scene before him, then stepped forward, eyes scanning the situation with practiced efficiency. Alexander, what do we have here? He asked, already beginning a careful examination of the wound. Doctor, Michael Everett, 43 years old, pediatric neurologist, impaled by a tree branch approximately 2 inches in diameter, entering through the left upper abdominal quadrant and exiting through the back. Hiking accident, fell about 20 meters. And, believe it or not, he got here on his own. Dr. Patel raised his eyebrows in astonishment, but continued his methodical assessment. Impressive, Dr. Everett, but extremely risky. Didn't have many options, Michael replied, his voice growing weaker as the morphine began to take hold. I've already ordered a CT scan, Dr. James added. No time, Dr. Patel interrupted, his blood pressure's dropping fast. We need to get him into surgery now. We'll have to assess the damage as we go. Dr. James nodded, fully acknowledging the gravity of the situation. He placed a steady hand on Michael's shoulder. We're taking you to the OR now. Dr. Patel is the best remedy I know. You're in good hands. Michael closed his eyes briefly, accepting his fate. Thank you for everything. As the team prepared to move him, Dr. James noticed something unusual, a small, shiny object tangled in the torn fabric of Michael's clothing. He leaned closer and saw it was a golden medical pin, bearing the caduceus symbol and the words, "For those who cannot speak." It was the kind of symbol many pediatric physicians wore. That small detail brought a deeply human layer to the situation. This wasn't just an extraordinary medical case. It was a fellow healer, a man who had dedicated his life to saving children, now fighting for his own survival. 7 hours later, Dr. James sat in the surgical waiting room. His shift had ended long ago, but he couldn't bring himself to leave without knowing the outcome. Something about this case had struck a deep chord. Maybe it was the patient's extraordinary courage, maybe the fact that he was a fellow doctor, or maybe just the bizarre and astonishing nature of the injury. Next to him sat Daniel Everett Collins, a tall, lean man with prematurely graying hair and red, tear-streaked eyes. Despite being ex-husbands, it was clear Daniel still cared deeply for Michael. We divorced 2 years ago, Daniel explained as they waited. Irreconcilable differences, as they say. But we stayed friends. He'd come over for dinner once a week. His voice cracked. He was supposed to be there last night, but he canceled to go on that damn hike alone. Dr. James just nodded, offering the quiet comfort of presence. In his hand, he held the golden pin he had removed from Michael's clothing before surgery. That pin, Daniel said, noticing the object, was a gift from me when he finished his pediatric neurology residency. He always wears it when he hikes or does anything risky. Says it's his good luck charm. Looks like he might need a bigger one, Dr. James replied, offering a small smile to ease the tension. Daniel let out a sad laugh. Michael's always been like that, you know, stubbornly independent. Once he set his mind on something, there wasn't a force on earth that could stop him. It's what makes him an incredible doctor, but also what lands him in situations like this. The doors to the OR finally swung open, and Dr. Patel stepped out, still in his surgical scrubs, the fatigue plain on his usually unreadable face. Both men immediately stood. "He survived the surgery," Dr. Patel announced, and Daniel let out a sharp, audible breath of relief. It was one of the most complex operations I've ever performed. The branch pierced his spleen, damaged part of the small intestine, and came dangerously close to the abdominal aorta. But miraculously, it missed it. "It came down to millimeters," Dr. James explained to Daniel. "If it had hit the aorta, he probably wouldn't have made it to the car. We had to remove the spleen and repair the intestinal damage." Dr. Patel continued. "There was significant blood loss, and we've started him on heavy-duty antibiotics for the next several days due to a high risk of infection. The wood was dirty and introduced contaminants directly into the abdominal cavity. The biggest threat now is sepsis. But will he recover?" Daniel asked, clinging to the sliver of hope he'd been offered. "It's too early to say for sure," Dr. Patel answered with professional honesty. "The next 48 hours are critical, but he's shown extraordinary strength and resilience so far. That counts for a lot." In the weeks that followed, Dr. James visited Michael Everett regularly, monitoring his recovery. The patient who had arrived at the hospital under such bizarre circumstances quickly became a legend among the staff. The branch doctor, as some of the less tactful interns had dubbed him. Recovery was rough. As Dr. Patel had predicted, Michael developed a severe infection that nearly claimed his life 3 days post-op. For 48 agonizing hours, he hovered between life and death, his body burning with fever, while broad-spectrum antibiotics fought to keep the infection at bay. During that critical time, Dr. James often found Daniel at Michael's bedside, holding his hand, whispering encouragement that the unconscious man couldn't hear. It was during one of these quiet vigils that Daniel opened up more about their relationship. "You know why we broke up?" Daniel asked, one particularly difficult night, when Michael's vital signs had dangerously dropped. He was addicted to his work, devoted every waking minute to his patients. He came home just to sleep, sometimes not even that. I understood his dedication, but after 10 years, I just couldn't keep competing with those kids. James nodded, recognizing the familiar pattern among many doctors, including himself during some of the rougher phases of his own career. "The irony is," Daniel continued, "it was only after the divorce that he started finding balance. He took up hiking, rock climbing, started actually living a little, and then this happens. On the 10th day of hospitalization, after the infection had finally subsided, and Michael was conscious and alert enough for longer conversations, Dr. James saw an opportunity to ask the question that had been nagging him from the start. "Why didn't you pull the branch out?" he asked directly, sitting beside the bed during his morning rounds. Even being a doctor and knowing you shouldn't, most people would have had the instinct to yank it out. Michael gave a faint smile. "Honestly, my first instinct was to pull that thing out. The pain was beyond words." He paused, reliving the memory. "But then I thought of the kids at the hospital. I have this one patient, Lucy, 5 years old, with an inoperable brain tumor. I promised her I'd be there for her next chemo session." Dr. James felt a lump rising in his throat. "At that moment, I decided I was going to survive, no matter what. And I knew that pulling out the branch would mean bleeding out in minutes. So, I did what I had to do." "You walked 15 miles with a branch going through your body just to keep a promise to a patient?" Dr. James asked, incredulous. It sounds crazy when you put it that way, Michael replied with a faint smile. But I've seen kids endure unimaginable pain and procedures without a single complaint. I figured I owed them at least that same level of courage. That was the moment, Doctor. James truly understood the magnitude of what he had witnessed. It wasn't just a medical oddity, it was a testament to human resilience, the power of determination, and the depth of a physician's commitment to his patients. 3 months later, Dr. James was finishing his morning rounds when he noticed a familiar figure in the pediatric hallway. Michael Everett, wearing a white lab coat with his name embroidered and the familiar golden pin on his chest, pushing a wheelchair, carrying a small girl with thinning hair and a radiant smile. "Dr. James," Michael called when he saw him. "I want you to meet someone special. This is Lucy, my favorite patient, and the reason I simply couldn't die in that forest." The little girl looked up with curious eyes. "Are you the doctor who saved my doctor?" she asked, with the frankness only children possess. Dr. James knelt down to her eye level. "Well, I helped a little, but your doctor here did most of the work on his own. He's very brave, you know." Lucy nodded solemnly. "I know. He told me we're brave together. I'm brave during chemo, and he's brave with mean trees." Michael laughed, a healthy, genuine sound that showed no trace of the ordeal his body had endured. "We're taking Lucy to her final chemotherapy session. Her latest scans show the tumor has significantly shrunk." "That's wonderful, Doctor," James replied, genuinely happy for both of them. As they said goodbye, and Michael continued pushing the wheelchair down the hallway, Dr. James noticed something different. Michael was not alone. Daniel was walking beside him, a hand gently resting on his shoulder, the two speaking in low, intimate tones. Later that day, Dr. James found a small package in his locker at the hospital. Inside was a golden pin identical to Michael's, with the caduceus symbol and the words, "For those who cannot speak," engraved at the bottom. Along with it, a simple card. "To the doctor who allowed me to keep speaking, for those who can't. With eternal gratitude, Michael Everett and Lucy Thompson," who bought the card. James pinned the brooch to his coat, feeling the weight of the metal against his chest, a reminder of why he chose this profession and of the extraordinary courage he had witnessed on what began as an ordinary day that became anything but. Some patients come through the ER and leave no mark. Others remind you why you became a doctor in the first place, and a rare few, like Dr. Michael Everett, the man who drove 15 miles with a tree branch through his body just to keep a promise, you carry with you forever. That night, as Dr. James left the hospital after a long shift, he touched the pin on his coat and smiled. In the often chaotic and tragic world of emergency medicine, stories like Michael's offer a powerful reminder. Sometimes, medical miracles don't come from doctors, but from the patients themselves,